السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 27 in Maternity and Child Health Nursing and number 66 in Ghaith Review. Today we are going to discuss 10 questions from question number 347 up to question number 356. معكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 347. A postpartum woman was discharged after 24 hours and received a home visit from the community nurse 2 days later. Which of the following findings is considered abnormal? The options are number A, frequent urination, number B, Lochia cirrhosa, number C, uterus below the symphysis pubis, number D, breast full of milk. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number C, uterus below the symphysis pubis. ليه اخترنا الخيار رقم C؟ نشوف rational. By the second day postpartum, the uterus should be around the level of the umbilicus or just below it, not below the symphysis pubis. If the uterus in that low or at the level of lower the symphysis pubis, it may indicate uterine atony or subinvolution, which is abnormal. So the correct option is option number C, uterus below the symphysis pubis. The remaining options are normal. Question number 348. A 23-year-old gravida 1 para-zero mother is attending an antenatal clinic. The health educator conducts a teaching session about fetal circulation in the waiting area. Which information should the nurse emphasize? The options are number A, one umbilical artery and one umbilical vein. Number B, one umbilical artery and two umbilical vein. Number C, two umbilical arteries and one umbilical vein. Number D, two umbilical arteries and two umbilical vein. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number C, two umbilical arteries and one umbilical vein. اللي اخترنا الخيار رقم C نشوف rational. The normal fetal circulation involves two umbilical arteries which carry deoxygenated blood from the fetus to the placenta and one umbilical vein which carries oxygenated blood from the placenta to the fetus. This is an essential concept in fetal development and prenatal assessment. So the correct option is option number C, two umbilical arteries and one umbilical vein. Question number 349. What is the expected type of Lochia on the second day after delivery? The options are number A, Lochia rubra, number B, Lochia cirrhosa, number C, Lochia alba, number D, white colored vaginal discharge. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number A, Lochia rubra. اللي اخترنا الخيار رقم A نشوف rational. Lochia rubra is the initial vaginal discharge after delivery, typically lasting 1 to 3 days postpartum. It is bright red and composed of blood, fetal membranes, and residue. So the correct option is option number A, Lochia rubra. Lochia cirrha or cirrhosa appears around day 4 to day 10, and Lochia alba comes later. So the correct option is option number A. Question number 350. A 30-year-old married woman has undergone dilation and curettage, D&C, as a therapeutic abortion. Which discharge instruction should the nurse include? The options are number A, taking high protein diet. Number B, use tampons during swimming. Number C, avoid sexual intercourse for 2 weeks. Number D, continue on bed rest for 2 weeks at home. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C, avoid sexual intercourse for 2 weeks. اللي اخترنا الخيار رقم C نشوف rational. After a D&C surgery, there is a risk of infection, so the patient should avoid sexual intercourse using tampons and vaginal douching. So the correct option is option number C, avoid sexual intercourse for 2 weeks. Bed rest for 2 weeks is unnecessary unless complication arise, and a high protein diet is generally healthy but not specific to dilation and curettage recovery. Question number 351. While the nurse is performing postpartum assessment for a primiparous mother delivered 2 hours ago, she found the following: fundus level at midway between symphysis pubis and umbilicus. The fundus positions at the midline, and the consistency of the fundus is contracted, and the lochia constant bleeding. Which of the following is the most likely causes of the bleeding? The options are number A, full bladder. Number B, perineal hematoma. Number C, birth canal laceration. Number D, retained placenta part. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C, birth canal laceration. اللي اخترنا الخيار رقم C نشوف rational. A firm and midline uterus indicates the uterus is well contracted and bleeding is not due to uterine atony. Continuous bleeding despite a contracted uterus suggests laceration in the birth canal. So the correct option is option number C. A retained placenta typically causes a boggy uterus, not constant bleeding, and perineal hematoma presents with pain and swelling, not visible bleeding. Question number 351. What the purpose of late vaginal rectal culture during antenatal screening? The options are number A, to screen for group B streptococci. Number B, to detect chlamydia infection. Number C, to screen for gonorrhea. Number D, to screen for syphilis. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number A, to screen for group B streptococci. اللي اخترنا الخيار رقم A نشوف rational. Group B streptococci GBS can asymptomatically colonize the mother's vaginal and rectal area and pose a risk for severe neonatal infection such as sepsis, pneumonia, and meningitis during the delivery. Identifying Group B Streptococcus allows for intrapartum antibiotic prophylaxis to reduce transmission to the newborn. So the correct option is option number A, to screen for Group B Streptococci. Question number 353. A woman at 24 weeks of gestation present with fever, body ache, and coughing lasting 5 days. She is admitted to the hospital with diagnosis of suspected H1N1 influenza. Which of the following physician orders should the nurse prioritize first? The options are number A, assign private room. Number B, vital sign every 4 hours. Number C, obtain specimens for culture. number D, ringer lactate IV. وقف الفيديو هنا واختار الخيار بشيء صحيح. The correct option is option number A, assign private room. ليه اخترنا الخيار رقم هنا؟ شوف rational. H1N1 is a highly contagious respiratory virus, and airborne or droplet isolation is required immediately to prevent transmission to others, especially in hospital setting. So assigning a private room or isolation room is the first and most important infection control step. So the correct option is option number A. Other orders can follow once isolation is ensured. Question number 354. A woman is diagnosed with gestational trophoblastic disease. Which laboratory investigation is used to confirm the diagnosis? The options are number A, cervical pap smear. Number B, serum HCG level, human chorionic gonadotropin. Number C, serum estrogen level. Number D, plasma thyroxine level. وقف الفيديو هنا واختار الخيار بشيء صحيح. The correct option is option number B, serum HCG level. ليه اخترنا الخيار رقم B؟ نشوف rational. Gestational trophoblastic disease is characterized by abnormally high levels of human chorionic gonadotropin, HCG. This hormone is significantly elevated in cases of moral pregnancy or gestational trophoblastic disease and is the key diagnostic markers. So the correct option is option number B, serum HCG level. Question number 355. A community health nursing is planning to conduct prenatal teaching for a group of pregnant adolescents. Which teaching strategy would be most effective? The options are number A, offering open sessions for pregnant adolescents and anyone else interested. Number B, designing poster for individual viewing in the clinic. Number C, preparing group class specifically for pregnant adolescents. Number D, conducting one-to-one teaching sessions for both mothers and daughters. وقف الفيديو هنا اختار الخيار بشيء صحيح. The correct option is option number C, preparing group class specifically for pregnant adolescents. اللي اخترنا الخيار رقم C نشوف rational. Group session with peers create a supportive and interactive environment, which is especially effective for encourage open discussion and reduce feeling of isolation. So the correct option is option number C. One-on-one or mixed group are less effective for this demographic. Question number 356. A 28-year-old multiparous woman delivered a full-term infant weighed 3,500 grams. During the active phase of labor, fetal monitoring show variable deceleration. The midwife is inspecting the placenta immediately following expulsion, referring to the picture or image. Which type of placenta is most likely? The options are number A, normal, number B, circumvallate, number C, succinate, number D, velmentos. وقف الفيديو هنا واختار الخيار والشوف صح. The correct option is option number B, circumvallate placenta. اللي اخترنا الخيار رقم B نشوف rational. Circumvallate placenta is an abnormality in the shape and structure of the placenta, in which the edge of the placenta roll inward, forming a thick-ended ring around the border. This leads to a smaller surface area for exchange, or we can say placental insufficiency, and possibly compromised fetal blood supply. So the correct option is option number B, circumvallate placenta. شكرا جزيلا. Don't forget to support us by comment, like or subscribe.